Hi, everyone. So let's just get started. Thank you to everyone who has tuned in this evening. You can continue to use the chat box to let us know where you're tuning in from. And what we're going to do today, I'm really excited because it's a lot of practice. You guys are going to be doing a lot of exercises right along with me. There's so many potential ones that we could do. Seated exercises is our topic of the day today. And seated exercise is my favorite position to exercise in, regardless of your mobility level. Whether you can run marathons or if you haven't ever ran, especially not in the last 20 plus years, I love seated exercises. Right, so we're going to get started. Again, it's best to have a chair that does not have wheels. That is what's going to be safest because when you're working on strengthening exercises and weight shifting, it is possible for the chair to move away from you. It's happened to me. And you can do these on a rollator, on the seat, of course, of a rollator. But I should put a disclaimer out there. I don't think any rollator companies will tell you to exercise seated on the rollator. You can do it safely if you're focusing on safety, and just make sure the brakes are on because you don't want to roll anywhere. Okay, so let me get my questions box back up in case you guys ask questions. Can we sit on the edge of a bed? Absolutely. I'm going to do these seated here, but anywhere that you're sitting. Sitting at the edge of a bed makes it a little bit more challenging because you're unsupported. So let's get started. I'm actually going to face this way first. That light was too bright. Okay, so first and foremost, a lot of you guys, if you're like me, you may have just been sitting like this, scooted all the way back, or at least maybe slouching a little, but relaxed. So number one, I want you to sit up tall. And in spirit of discussing seated exercises, this is its own exercise. Practice sitting back and slouching, and then sitting up tall and slouch and sit up tall. So for right now, we're just going to do a bunch of different examples, a few repetitions each. If you like any of these or if they speak to you, you can do them, add them into your daily routine. But we're not going to spend, we're not going to do 10 sets of each of them or repetitions. So for this first one, just practicing sitting up tall, really focusing on using your core muscles to bring you up tall and relax. This should feel like an exercise for most of us. So that's just getting into this tall position. Now from here, another exercise to get into a tall position is scooting forward. So as you can see, I'm still pretty far back in my chair. There's zero chances I'd be able to stand up well from this far back in a chair. So I could scoot forward. Don't use your hands if possible. And then scoot backwards. Even better if you can tighten your core muscles while you're doing this. This is a great core and hip exercise. Push back, back, back. You should feel your ab muscles working at least a little bit, especially if you are, again, focusing mentally on tightening those belly muscles. Now, if you can't do this without using your arms, then use your arms 100%. Do what you got to do the exercise. But scooting is a very functional exercise because, again, if I'm back here and I want to stand up, I have to scoot forward. If I can't even, I'm too far back to really stand. But if I scoot forward, it's going to be much easier for me. So you get it. Sitting up tall and slouching, scooting forward is another great one. But now that we've scooted forward, now we're in a true tall sitting position. And if you're at the edge of a bed, you're also in this position because you don't have back support. I call any exercise we do from here unsupported because you have no back support. You can see my back is not touching anything. Even if you have your hands on, like if you're in a wheelchair and you have your arms on your armrest, or if you're in a regular chair with armrest, you can hold on to those. That's still considered unsupported. It's just anything without your back touching. Okay, now we get to have some fun. So from here, let's start with our arms because we'll start top and work our way down. Some of my favorite arm exercises I also use for cardio. So I'm just gonna run through a bunch with you guys right now. So hands in very light fist. Don't squeeze too hard. Light fist, and punch forward. This is a great strengthening exercise. It's also a great cardio exercise. If you're doing this for cardio, go faster. And try to stay at shoulder height. If that bothers your shoulders at all, just punch down. Like that. Another one is punches, side punches, or hooks. If you've ever taken boxing classes, these are hooks, just coming around to the side. Keep your core muscles nice and tight the whole time. Now you're doubling as a core exercise. So keep going. Another one is uppercuts. You're just punching up. And keep in mind, if you have difficulty with coordination, just move. If you just attempt to look like me right now, that's exercise. It's working your core, it's working your arms. Another one for my arms, reach and pull, reach, pull, reach, pull, overhead and pull down. You should feel your torso right here, stretching and then pulling down. Stretch, pull. So this is a great exercise. Again, if you have shoulder limitations, just pull from your forehead and down. Or even your chin and down. That's more of a elbow exercise than shoulders, but it still gets you moving. Chin and down, chin and down. So any variation of the reach and pull is another favorite. You can do rotating punches. Again, this is all core, cardio, and upper body. If you want to go for cardio, just go a little bit faster. Faster is the easiest way to get it to be cardio and not just strength. So you can do that. So those are some, there's a bunch, but those are some of my favorite upper body strengthening and cardio exercises. If we move on to our core, I'm going to show you guys my two favorite ones. We're going to scoot to the edge. Again, that's partially an exercise too. Widen your legs and then sit up tall. And you can have your arms forward. Sorry, my nose is really itchy right now. And what you're going to do, keep a flat back as you hinge backwards and up. Backwards and up. The further your feet are away from you, the easier this is. If your knees are really bent, you're going to just collapse backwards. So keep your feet away from you and just hinge back as far as you can go. You might be able to go further than me. You may be able to tell this or not. I can't tell. I'm not touching the back of my chair. If I go any further, my abs lose grip and I just plop back. So go as far back as you can without losing it. If your arms get tired here, you can lower them here. If it's too easy, you can cross your arms here. This makes it harder. So you should feel this, especially if you're mentally focusing on your abs, on what muscles you want to use. You should feel this here mostly. You will feel it in your hip flexors, but you should mostly feel it in your belly muscles. So that's one of my favorite ones for the front of the abs. One of my favorites for the side, I'll face you guys. I like to call the penguin or the teapot. If you haven't done this with me before, I think it's a fun one. So you're sitting up tall, unsupported, arms down by your sides, fingertips facing the floor. And you can either think of yourself as a penguin, like you're waddling. So you're just tipping to one side and up, and on the other side. But you'll see, hopefully you can tell, it's just my upper body moving. I am not shifting my body weight side to side. My hips are staying down. It's just my upper body tipping this way, up, and then tipping. So I call this the penguin because I feel like a penguin. But more recently, I also call it the teapot because if you picture that song, the I'm a little teapot, short and stout, here's my handle. No, here's my handle. Here's my spout. Tip me over and pour me out. It's that same type of tip. You're not leaning, you're just tipping. I gotta play that song because now I can't remember the lyrics. So this is my favorite one. You should really feel this in your obliques. This is another one where everyone is different. I personally, this is as far as I can go. If you have a longer torso, you might be able to go much further than me. I can never get that close to the ground. I have some clients who can get close to the ground just because of their torso and their flexibility in their torso. Last thing I want to show you for this one If you're doing the penguin or the teapot correctly, you're staying in line with your body. You're not coming forward. If I come over here, I can get very close to the ground. That is not the exercise. The exercise is tipping and then tipping. So it's just purely side to side, not coming forward at all. With that said, another great core exercise that you can do is reaching forward in so many different positions. You can just reach forward like this and then slowly back up. Or maybe you reach diagonally. You can try to touch you guys. I can try to reach down towards the floor. Finn's ball is right here. I can pick this up and maybe I try to put it down in front of me. So you can just reach in so many different positions and you should feel your core, your back, your side muscles working. It's a really great exercise for core, but also balance and weight shifting. Which brings me to my next one. You can practice shifting your weight side to side. Reach, this time you are lifting your butt up off the chair and then down, and then the other way. You are lifting your hips. So the first one with the teapot, we were just tipping. We didn't move our hips at all. This time we are moving our hips. You can see my leg lifting. You can go this way. So weight shifting is another really great exercise to help with balance. Now, let's get to our final set of strengthening exercises for our legs. Let me move this down a little bit. So strengthening exercises can be done sitting up tall, as we all are right now, or reclined. And let me tell you, a lot of the seated exercises are challenging. They should be, but the way to make them easier most times is to recline backwards. So I'll show you both options. My 3 favorite exercises of all time for people looking to improve their walking is marching, leg kicks, and ankle lifts. So marching would look like this. So you sit up tall, so you're using your core, and just lift as high as you can, whatever that looks like to you, even if there's no movement at all. But I will say, this is the hardest position to do marching in. Even standing is easier. So you can scoot back slightly, recline, and march from here. It should feel easier. Even if it's still really challenging, it should feel easier. So this would be a reclined marching. Another one is leg kick. So straightening and bending your knee. Straightening and bending. Straightening, bending. Now again, this tall, unsupported position is often very challenging. You can scoot back as far as you can and do it here and bend. Straighten and bend. So you're still tall, but you are now supported by the back of your chair. And then the last one, let me change my angle here, is the toe lifts, the ankle lifts. So sitting up tall, feet are further away from you, up, down, up, down, or maybe you just do one side at a time. You can individualize this for you and your body and what works best. But these are all the different types of seated positions and seated exercises that you can do to work on your leg strength, your core, your upper body strength, your cardio, on so many things. And if you can do it while you're doing something else, you could do this while you're responding to an email, between responding to emails, as you're taking a water break. You can do this so much throughout the day. Pick one and do it at some point throughout the day. There we go. Okay, so I'm just going to go through these questions. Are you using your feet to scoot forward and backwards? You do move your feet as you scoot forward and backwards, yes. What if one side is significantly weaker than the other? So I think I just answered that. If one side is significantly weaker than the other, still do it. I will never give you the option of just not doing it or doing fewer repetitions. You might have to take more rest breaks, but you'd still do the same exercises. What about using a stability ball? Yes, absolutely, that's an option. Are there benefits of doing the penguin with light weights? Absolutely, yeah. So you can modify any of these. And by modifying, I also mean making it more intense. If you want to add weights or resistance bands, go for it, absolutely. If you still have good form. Form comes first. So if you have good form, go for it. But if you don't have good form, don't add anything yet. Teapot feels good. My spine cracks a lot though. Maybe it's just my age. Can vestibular training help make a neuro pathway to the nerve in the ear for balance? Oh, that's a good question. All tests show ear anatomy is fine. It is the neuro pathway. That's a really great question. I will start this by saying I have not specifically researched this before, but my intuition is telling me that inner ear training your vestibular system for your inner ear is different than training your vestibular system for balance. There's lots of vestibular training that you can do for your inner ear that's not related to balance. Like you're even lying on your back for some of them, or vestibular training for your inner ear. You can be, my shirt's all wrinkled the wrong way. You could be sitting up tall and just move your eyes one side to the other. This is vestibular training. That doesn't have anything to do with balance, like standing balance at least, or up and down, or eyes stay straight, but your head moves. So there's definitely a commonality there. You know, vestibular system absolutely plays a role in balance, but I do think there's different types of exercises for that. I lost my space. Okay. My foot doesn't go straight due to foot drop. Am I doing it wrong? If your foot doesn't go straight, that's fine, but it's definitely something to work on for sure. Your goal would be eventually to have it straight. You just described my problem. If I sit on the chair and hold my leg up for several minutes, is that okay? Great question. Yes, that's okay, but you're working on something different. Not that it's wrong, it's just different. So there's a difference between strength and endurance, and we actually have an upcoming webinar for moving with MS on the difference here. But to explain it briefly, if you are looking to do something over a longer period of time, like if you want to be able to use your hip flexors for longer or walk longer, you have to practice in an endurance way. So when you're practicing where it's the marching, but you're just holding your leg up, you're practicing endurance. So you'll be able to use that muscle over a longer period of time. With that said, that doesn't always correlate to being able to do more repetitions. So you might be able to lift and hold for a minute, but if you do repetitions, you can't do as many. So I always like to work on strength and endurance, not just one or the other. And I always, if you have to pick one to start with, I always start with strength. And strength means practicing more repetitions versus longer holds. Exercise is always such a big conversation. You know, as a physical therapist, people ask me most about exercises and what's best and what to do and where to do it, when to do it, how to do it, how many to do of it. So it's a lot. All right, guys, thank you so much for joining. I say this every time, but I truly mean it. Thank you so much for hopping on these. It brings me so much joy and lights up my fire and my passion to help people with MS when you guys do hop on and participate and chat with me, even though I can't see you. So thank you for joining. Thank you for participating. Bye, everyone.